This is the Dr. Berg Show. Live from the nation's capital, it's time to get healthy, lose weight, and feel great. Call now to speak with Dr. Berg at 866-561-4292. And now, Dr. Eric Berg.
Hey guys, welcome back. It's Friday Q&A. This is live, and I'm here to take your questions. One little minor point that if you have one question, that would be great. If you have multiple questions, a huge evaluation, we won't have time. We have a ton of callers already waiting in the list all over the world. So if you want to call in, here's the number, 866-561-4292. The last 2 weeks, on some of the communications, I put the wrong number. Sorry about that. But it's 866-561-4292. Go ahead and call. So we're going to take a caller from Joanne, London. You're on the air. Go ahead, Joanne. What's your question?
Hi, Dr. Berg. My husband's been following your advice for about 6 months and has lost a lot of weight and is generally feeling a lot better in himself, and has been able to identify a few issues. So he suggested that I give you a call about myself. So I've switched from an antidepressant, a UK antidepressant, onto the 5-HTP, depend on sort of the information that my husband had read on and listened to on your pages. But since going on to that, I still have bouts of sort of low mood. I put weight on because I tend to be comfort eating more and things. So we're just wondering, really, is there anything else that I should be looking out for? Is there anything else I could be doing to sort of just try and pick up my low mood?
Okay, so Joanne, just a quick question about that. Have you also changed your eating? Is it really good, or are you still eating comfort food?
Since my husband's been doing your information and sort of following your information and things, my eating has improved, but I am still eating quite a lot of rubbish, which I am finding really difficult to stop. I am
Is it
still
hard?
comfy.
Is it hard? I mean, is it? I would assume, like in London, it's all really, everyone eats healthy. It's all really good food, right? I'm being
Not
sarcastic.
Really, no. I'm still eating a lot of chocolate and cake and biscuits, and when I'm feeling a bit that's what I want to eat. So
Right.
And I find it very difficult. My meals though are better.
Good.
And my husband says I'm an adrenal body type, if that helps.
Okay. Well, let's answer your question. So obviously, we want to get to the root cause. We want to fix the real problem, which is the diet. When you are on a psych drug for a period of time, it really causes a chemical shift in your body. You become almost dependent on that because, like, for example, Prozac, it'll take that last drop of serotonin and keep recycling it over and over, giving the illusion that you are fine, but really, as soon as you come off of it, you might crash and burn. So you're taking L-tryptophan, which also is a precursor to serotonin, which is really good. But unless you really change your diet, you're going to go into that whole blood sugar up and down thing. And when the blood sugars are up, it really affects the cognitive function with almost like a fatigue. When it's down, it can create all those negative emotions, from panic attacks to worry to like fear to depression and all these other irritability, nervous, and all these other symptoms. So honestly, I think once you bite the bullet and go full bore with that healthy diet and your blood sugars are handled, I think everything's going to be, you're not going to need it, because 50% of all these so-called mental disorders or psychiatric disorders are really related to nutrition, from my experience. And then one other thing too is that you want to actually have substitute foods. You want to have recipes, so you don't want to deprive you of things that you like. So I created a lot of recipes on the keto bombs, little cookies, little this, little that, chocolate treats that you can eat. You just have to make them as your fallback. So that way you don't have to deprive yourself. So start making those, keeping those in the house, get the junk out of the trunk, and you'll see that I think it'll long term it's going to handle the real problem. Okay? All right. So Steve, you're from Alabama. You had a keto diet question. Go ahead.
Hey, Doctor, how you doing? Just a quick background. over the last year, I lost 100 pounds, and I was working out, training to be a bodybuilder at that time, and I was eating a lot of meals a day, and I lost the weight, but I kind of got tired and got run out of eating so much every day, and I got introduced to the keto diet, and between that point, I put a few pounds back on, about 20, 30 pounds. I was trying to get it off, and I got on the keto diet, and I lost 20 pounds. But I got back on my other eating plan, and I think the keto diet is a better way, and so I decided to do it again. So now I'm on it again, but this time I've been on it for 2 months, and I'm at the same weight. I can't seem to lose the weight. So, I've been doing the same thing I've been doing before.
Steve,
I don't know what.
Steve, I have a question.
Not coming off. Yes, sir.
I have a question. Are you losing any inches in your stomach at all?
Well, it doesn't seem like I haven't really measured out, but as far as my pants, it's still about the same size, you know. I guess I didn't measure that.
Okay.
To start off with. But.
All right. So let me just kind of cover that. So Steve has been on the ketogenic. He's done it several times. Now, all of a sudden, it's not working anymore. There's a couple things that, I look at, and that if that happens, number one, I'm going to look at, are you doing it correctly? For example, are you doing intermittent fasting with ketogenic? So if you do the ketogenic diet, they don't really necessarily differentiate when you eat or how many meals you eat. It's just basically higher fat, low carbs, and protein. So what we want to do is we want to have maybe 2-3 meals a day. Okay, no snacks in between. That's number one. Number two, are you doing enough greens, all the salad, all the vegetables, just to get healthy? Because really, it's not lose weight and get healthy. It's get healthy first to lose weight. So whatever that means. The third point I would look at, Steve, is I would look at other factors that could be slowing you down. How is your sleep? How is your energy? Do you have inflammation? Do you have any other body issues? The weight's just one indicator, but we want to look at the whole picture. I really don't have time to evaluate everything, but I have some videos on how to debug if you're not losing. So why don't you check that out? I think that will help. Okay, thanks, Steve. Renee, you're from Texas. You have a question. Let me pull you on.
Thank you so much for your videos. It's been really great to hear about these diets. My question is about vitiligo.
Yeah.
About 3 years ago, my skin started to develop these white patches, and I just wanted to see if you had any information to help heal that.
Yeah, good question. How long ago was that exactly?
It was almost 3 years ago exactly.
3 years. Okay, do you know, was it in the spring or the fall or the winter?
It was right now in the spring.
Spring, okay. Did it happen all of a sudden or was it gradual?
It was gradual. It started with one spot that I thought was like a scratch that didn't heal, like a scrape that didn't heal, because it just, how your skin, when you have a scab, that it's white, and then it just kind of developed from there.
So was it 2 years ago or one?
3 years ago.
3 years ago, okay. Was there anything that happened just before that as far as a stress event?
Yes, I had a stressful job, and then I had a financial loss.
Yeah. Okay, so let me just cover that, Renee. Vitiligo, Michael Jackson had it as well, is always connected to the adrenal glands, and it's not actually high cortisol, it's low cortisol. It happens also in a condition called Addison's, which is a complete burnout of the adrenals. And so it's really an adrenal issue that's triggered by stress. Every single case that I've seen coming through my office, it always comes after a stress. So really the only thing that I would recommend is do everything you can to undo and repair adrenal glands and remove that stress. That's really the only thing you can do to help that. So I would support the adrenal. But again, it's an adrenal issue. It's usually low cortisol. And I have specific videos on that you can watch. But that's where I would do my research. All right? Thanks, Renee. Hey, Mike, you're from Kentucky. Go ahead. You're on the air. You have a prostate and blood pressure question.
Yes, I have both. I have an enlarged prostate, and I also have a real high blood pressure. I've lost 28 pounds since January. Feel great other than that, but my doctor has put me on some medication to try to get my blood pressure down, and that's not where I really want to be.
Got it.
So what can I do? Yeah,
there's a couple things that you can do, Mike. What happens with prostate is everyone is blaming it on high testosterone, a testosterone called DHT, and they say, oh yeah, it's testosterone, that's what caused it, it's DHT. But that doesn't make sense because as you age, testosterone goes down, it doesn't go up. Really, the underlying issue for the prostate is either two things that I see. Number one, it's high estrogen levels, okay, estrogen levels. And so if you take foods that are, consume foods that are anti-estrogenic, like cruciferous, that would be very, very helpful. The other thing to take for prostate is stinging nettle root, because that gets rid of inflammation, and it's wonderful for the prostate. But as far as when you have blood pressure too and prostate issues, I would investigate vitamin K2. Vitamin K2 removes soft tissue calcium from the arteries. It's great for blood pressure. And you always take that with vitamin D, which also happens to lower blood pressure. So they work together, vitamin D and K2. I have some videos on that. So it removes calcium from the system, and it puts it into the bone. It puts it where it should be. So it takes calcium where it shouldn't be and puts it where it should be. But those two vitamins are fat soluble, and those are also related to prostate issues. Okay? So why don't you just research the K2 and D3, and I think you'll probably have a better solution than anything else. All right. Thanks, Mike. Appreciate it. Teresa, you're from Georgia, and you ketogenic diet and diabetes. You have a question about that. Go ahead.
Thank you so much for taking my call, and thank you so much for your YouTube channel. I personally have lost 45 pounds in the last year using all of your advice.
Amazing.
Thank you. My question is for my husband. He has type 1 diabetes since 10 years old, and he's not your atypical overweight diabetic, but he has the round belly, the fatty liver. Is it possible for a type 1 diabetic who is on the insulin pump to have insulin resistance and be a type 2 simultaneously, like a double diabetic, if you will? If so, what would you suggest?
Yeah, good question, Teresa. There's a huge confusion about type 2. Sometimes when I do a video on, type 1. Type 1 diabetes, which basically means the pancreas has given up. It's not producing any insulin anymore, okay? There's a huge thing where I'll do a video on that, and some people will kind of like disagree because they'll say, no, I did research and I found that it's all genetic or autoimmune. Well, let me just give you another viewpoint because, yes, you as a child, all of a sudden you can develop it out of the blue, but I'm telling you what happens when you have a type 2, and I just want to bring this up just for everyone else. When you are a type 2, which is insulin resistance, and it's really the insulin cells are not connecting into the cells anymore, so it doesn't have the normal feedback loop. And then type 1 is where you don't produce any insulin anymore, so you need to be injected. Type 2 diabetes eventually gets worse, and so a lot of type 2 then eventually needing insulin. Why is that? Because they are becoming type 1. They're burning out the pancreas. Now, if you were to provide the same solution for type 2 to type 1, I think you're going to improve it greatly. It really depends on how bad these beta cells are on the pancreas, the cells that produce insulin. If those are really completely shot, you can improve it, but I don't know if you can actually fully resolve it. But I have seen type 1s completely go to type 2s and then completely be resolved. And I'm not going to give you any promises or guarantees or anything like that. But yes, when you're type 1, you can also have insulin resistance. Absolutely. Because the amount of insulin that you're being injected and you're being exposed to. I would apply the exact same principles that I'm recommending for type 2, which is intermittent fasting, if at all possible, cutting out your carbs and all these other factors. And as far as nutrition goes, to decrease the need for insulin, you need vitamin B1, chromium, apple cider vinegar, vitamin D, a lot of potassium. These are all nutrients that will decrease the need for insulin. So I would do that, and I think you'll actually see fantastic results. Okay? Thanks for calling. Janine, you're from Georgia.
Hey, Dr. Berg.
Hi.
I love your videos. Thank you for taking my call.
Oh, thanks.
I'm asking about gout. I got gout. I've been drinking spinach smoothies, and I think that brought this on.
Yeah. Okay. So good question. Oh, I'm sorry.
I got a prescription, but I don't want to take it. It's got too many side effects.
Right. Okay, well, let's talk about gout. First of all, I want to just mention all this advice I'm giving people about medical conditions, this is just my opinion, and you just need to check with your doctor before taking that advice. I just have to make the disclaimer, okay? So here's the thing about gout. Gout is a problem with high uric acid. Uric acid is a byproduct of protein where you have too much what's called purines, okay? And there's certain foods that will have purines in it too, especially the liver, kidney, scallops, sardines, herring, even chocolate and caffeine has these purines, and that turns into uric acid crystals. And it's really not necessarily, the root cause of it is it's not just diet, it's not just eating those foods high in purines, it's a dysfunction of the kidney, or it's what's more valid is if you have insulin resistance. If you have too much insulin, you tend to have high levels of uric acid, way more than just eating those foods. So that's the underlying root cause. Now, you can also have high uric acid crystals from consuming fructose. Yeah, and that's high fructose corn syrup, so you have to completely eliminate that. But mainly, it's an insulin issue. So one of the best things that you can do to handle that is lemon juice. That's why I consume a lot of lemon in my diet, constantly doing lemon, because when you also do the ketogenic diet, which I'm doing, it tends to, these ketones tend to compete with uric acid. And so you might end up with a little bit more uric acid because they compete. And I'm not going to get into the physiology of it, but the point is that for you, I would start down in the lemon. I would probably add the apple cider vinegar. You can do cherry juice, but that's too sweet. So I'd stick with large amounts of lemon, and that should handle it, and probably avoid some of the purines that I just mentioned, okay? All right, thanks, Janine. Appreciate it. Okay, so Jarrett, you're from Dallas, Texas. You have a ketogenic diet question. Go ahead.
Yes, thanks for taking the call, and thanks for all of your videos.
Sure.
I started the ketogenic diet back in December, lost about 23 pounds so far. And the question was, I watched a ton of your videos, learned a ton from it, but what I haven't seen a lot of is discussion about exercise in relation to the ketogenic diet, and just wanted to kind of see what your thoughts were on that. I'm a cyclist, and I ride about 6 hours a week right now, but I'm wondering if that is everything I need to be doing, or if that's too much of that, or essentially a good exercise program to kind of go along with the ketogenic diet.
How old are you, Jarrett?
46.
46. Do you still need to lose weight?
I do. Yeah.
Okay. And do you have how is your sleep?
Good. 8 hours a night usually.
Good. And how is your recovery? Can you recover pretty well?
From cycling, definitely.
Okay.
I've been doing it for a long time, but
good. Are you losing any muscle mass?
I don't really have a good way to tell.
Okay.
I mean, I'm definitely losing some inches, definitely losing some weight, but I'm not sure if it's percentage fat or muscle.
Okay, cool. So let's just talk about exercise for a couple minutes here. There's certain exercises that are good, not necessarily for a ketogenic diet, but more for the body types. And I wrote a book about it, but don't buy it until I come out with the new version because it's completely different. The old version is outdated a bit. But anyway, here's the point. The more adrenal you are, that means you're not recovering. The more stressed, the more you're not sleeping. You got to be careful about overtraining. You want to do like low-level type stuff, Pilates, yoga, and walking, light bike riding. As you become more fit, it's much better to do interval training type exercise. And I want to talk about that because interval training is more natural to the body than sustained bike riding and or any type of sustained exercise, jogging, bike riding. It's not really good on the heart to do sustained anything. It's a huge stress because just the natural wave of the flows of the body ebb and coming up and down, ebb and flow, up and down. You have the heart rate that contracts and relaxes. You have circadian waves. You sleep and you're awake. So when you do a sustained stress on the heart, it's not very natural. What's much better for the heart is this erratic sprint coast, spike it, relax. So all the exercise that I recommend and I do are to bring the pulse rate up really good and then just to chill it out. And if you do that repetitively back and forth, especially when you're riding your bike, you're going to get a lot better results. However, if you want to maximize weight loss, the absolute best thing to do is to do full body. And you could maybe do this with a spin bike or actually a regular bike if you get your whole body involved. You want to get your whole body involved with high intensity compound resistance, which is using as many muscles as possible, short duration, high intensity, lots of rest, back and forth, back and forth. And I have just released a video on that. You can check it out, but to get in the details. But that's just my general answer on that. Okay, Jarrett, thanks for calling. Now, Tyrone, you're on the air. You're from New Jersey. Go ahead.
Hi, Dr. Berg. The one question that I had is, from watching a lot of your YouTube videos, I'm learning that there are so many variations of vitamins that we should be taking to live a much healthier life. I'm dealing with some obesity right now, and I just started to take back over my health as I've just turned 40 years old. So I'm just trying to figure out where exactly do I start? Because I read a lot about the various vitamins. I get a little overwhelmed, the apple cider vinegar, things of that nature, and I know that food plays a major role in it as well. But just really trying to figure out where do I begin and what is the best recommendation for starting out with various vitamins. I hear a lot about the K2 and the B3. I'm anemic, and I also have high blood pressure, and I'm also dealing with gout right now. So.
Yeah. Okay, great, Tyrone. Let's talk about that. That's a long answer to that, so I'm going to give you my short version. As far as vitamins go, I always like to take your weakest link of all the things because, of course, if you start studying about vitamins, like I have, all of a sudden you want to take everything. I used to have a warehouse of nutrition, just taking tons of stuff because I'm like, well, that's good for me, that's good for me. So you can always take everything. But I like to go, what's your weakest link? What's the deeper root cause? So I would take, like you have said, you have blood pressure and you have gout. I would take both of those topics, pull the string, and like for the blood pressure, you got D3 and K2. Well, that's an essential thing. Gout, you probably need potassium citrate. So that's another thing that you could focus on. That would be like the most important right now. But as far as nutrients in general, the hardest nutrients to get, or what most people are deficient in, is the fat-soluble vitamins and the trace minerals, because it's just hard to get that. Probably because the liver is not producing enough bile to absorb it, because they have digestive issues, and then trace minerals are just not in the food. However, when you also buy vitamins, make sure they're food-based, they're not synthetic. That's the other thing that people don't know about. And then the other thing, too, is that vitamins for weight loss in general, there's really not a vitamin that dissolves fat directly. What we have to do is we have to ask ourselves what causes weight gain, and that's really high insulin. So any nutrients that are going to support insulin will help weight loss. And I'll just kind of name out some key nutrients that will support the problem of insulin. Okay? Potassium. That's crucial. The more potassium you have, the less insulin you're going to make. Vitamin B1. That's a nutritional yeast. The more B1, the less insulin you're going to make. Chromium. That's going to lower insulin. Apple cider vinegar. Vitamin D. Those are all real key nutrients, and magnesium, that actually will support weight loss by reducing insulin. All right, Tyrone, I hope that helped. Thanks for calling. All right, so Kim. Kim, you're from Maryland. Go ahead, you're on the air.
Hi, thank you for taking my call. I love your videos. I hope you can help me with this problem. I have a severe nightshade allergy. If I ingest anything with nightshades, I will get spasms that are so bad, it feels like I'm being stabbed over and over again. It can accumulate up to over hundreds of spasms a day, and they last for about 2 months.
Oh, my goodness.
Yes, I just had an episode. I'm sorry. And I think I'm about to have another one.
Okay, Kim, question. What out of all the nightshades, which one is the most reactive to your body?
I'm not sure. I know tomatoes, eggplant, peppers, potatoes, white potatoes, not sweet potatoes, but all of those. I've had this for over 12 years, and nobody can seem to help me.
Okay, question. I have another question, Kim. Do you just find that you accidentally get exposed to these foods somehow and then you react?
Yes.
Okay. Yeah, it's hard to avoid those nightshades. They're in so many foods. What I would do if I were you, Kim, is I would seek out in your area someone who does the technique. It's called NAET. It stands for Nabutra Allergy Elimination Technique. That's really the only thing that I know that actually helps reduce the allergies, if not gets rid of allergies. It's called NAET. Do some research on that, and that's what I would do. I don't think a nutritional handling is going to help you with that, especially if it's that specific. Okay? NAET, check it out.
It's called NAET. What
Yeah.
else?
NAET, Nabutropod Allergy Elimination Technique. There might be someone in your area that's good, and go to them and see if they can help you with that, okay?
Okay.
Okay. Thanks, Kim. All right. Then we have a question with Nala from California. Go ahead.
Good morning, Dr. Berg. I just would like to thank you because really you changed my life. Because I have a big problem all my life. I suffered from fibroids, and I removed one of my ovary, and they removed half of my. I have a lot of fibroids, and the second ovary, I have a lot of cysts. So I was suffered all my life. I don't know what I have, and lately, like last 3 years ago, I gained a lot of weight. I reached 265. And last year, the doctor found out that I'm pre-diabetic, high cholesterol, and all of this makes me really scared. So I was on diet, but my diet was on fruits. And I didn't really lost much. I lost like in 1 year 35 pounds, and I started this year in January for 40 days. I started HCG. I know you don't like it, but I was very depressed. I lost like 20 pounds in 40 days, but I was very depressed. I followed your diet, keto supplement. I lost like 10 pounds in really 3 weeks, especially in size. And everybody just got shocked when they see me now. But it's plateau again. I take estrogen, your balanced estrogen. I take a lot of supplement of yours. I really love it. But just tell me, help me to lose more weight. And I'm now 194. So I want to reach, my average is 150.
Okay.
And the last thing, I would like to thank Joyce, works at your office. She's very honest because I brought wrong supplement from customer service, and she called me. When I called her to get keto, she told me this is wrong one for you, return it, and we're going to send you another correct one.
Awesome.
So thank you for your honesty and
Thank
for
you.
saving us. Really.
Okay, great. Let's talk about that. So you're plateaued. You have lost a lot of weight. You're taking nutrition. You had some ovary issues. I think you said fibroids, which basically, see, that's the area that came first probably. So I always look at, okay, so you have all these issues. You got diabetic, pre-diabetic, and now all of a sudden I want to take it back earlier. What was like that first condition that triggered this thing? And it sounds to me that it's ovary or fibroid, and which means that the estrogen went too high. A couple things that what I would recommend, I would focus on the first things that trigger this whole series of chain reactions that occurred, which is high estrogen. Even though you may be menopause now, I don't know, and that's why it's hard to do this evaluation on the phone. But here's some points about estrogen. You're taking estrogen balance, which is right now my estrogen balance with DIM, and that's good because that reduces the bad estrogen and balances you out. But I would also focus on iodine from sea kelp. Iodine decreases the need for estrogen. Iodine is great for fibrocystic breast. It's great for ovarian cyst. It's good for estrogen dominance. And it also feeds the thyroid. The problem with estrogen is it increases and it blocks the thyroid gland. So here you are treating the thyroid and you don't get any results because it's really high estrogen. It's not a primary thyroid issue. So if you're plateauing, it could be that your thyroid is just not working because of this estrogen problem because of the iodine deficiency in the first place. So I always kind of try to think like what's behind things. So I would go after that issue first, and I think that just might tie it in. Like I'll have some people that you help balance the estrogen and they do better, but then they don't really get better until you feed them the iodine, and then boom, everything falls into place. So again, in this Q&A, I could only kind of give little simple answers. So I hope that might be a good tip. So go ahead and try it out and then let us know, okay? Thanks. Hey, Frank, you're from Canada, and you have blood pressure, or you asked a question about blood pressure supplements. Go ahead.
Good morning, Dr. Berg. I've been on blood pressure pills from early age. It's been 25 years, and also Effexor anxiety for about a good 15 years. And I like to get off of these, and it's not like, I don't know where to start.
Okay, so Frank, let's just talk about that, the blood pressure thing. And again, this is just my opinion. Take what I have, check with your doctor before taking anything. But with blood pressure, there's two things that I really focus on. One is the vitamin K2 and vitamin D3. Those two together work really good on blood pressure. And so because that removes the calcium, and also K2 makes the arteries very elastic, and therefore allowing the pressure to come up and down. Because what happens with blood pressure is your arteries become too rigid, and then you get atherosclerosis and hardening of the arteries, and then the blood pressure stays high all the time. So that's one thing. But the other thing that can also make your arteries elastic and bring down blood pressure, and this is totally so common, is a potassium deficiency. And but you might go to the doctor and have them test your potassium. Everything comes out normal. Well, do you know that 98% of all the potassium is inside the cell? It's not in the blood. So it's not going to show up. It's not going to show up. A better thing to do is be to take some potassium citrate in larger amounts and then see if your blood pressure goes down. There's no side effects. It works a high percentage of the time. It's very natural. And but I think the reason why people are deficient in potassium is because they just don't consume enough vegetables, because you need about 7.5 to 10 cups of vegetables every single day to get your potassium, and that's hard to do. And also, sugar depletes your potassium. High blood pressure medication depletes your potassium. So here you end up with a potassium deficiency that goes beyond the diet. So Frank, I would go after the potassium stuff, and I would also K2 and D3. Those are the three things that I would focus on, and I think that might help you. Okay, Frank? Okay, so now we have a call from, it's Gayla from Tennessee, East Tennessee. Go ahead. You're on the air.
Hi, Dr. Berg. Thank you very much for taking my call. I've been following you for quite some time. Well, January 1st. Feels like a long time. And I am curious in all my reading. The intermittent fasting, specifically 20 hours fasting, 4-hour feeding window, I consume between 12 and 1,500 calories in that 4-hour window. How is that different than calorie deprivation long-term or calorie restriction long-term?
Good question. I did a video on that. So when you have intermittent fasting, obviously you're not eating as frequent, which means you're going to eat less food. Okay, so that's a given. The key and difference between low-calorie diets and intermittent fasting has to do with the number of nutrients, not the calories. It's the number of nutrients in those calories. So if your meal or meals are robust and they satisfy all the nutrient requirements, and you may need to supplement to get that, then it's going to be fine. When you calorie restriction, you're doing small meals with very low nutrients. For example, the U.S. government recommends that we have at least 2.5 to, I think it's up to 4, maybe 5 cups of vegetables per day. That's not enough. That's not enough vitamins and minerals to satisfy your basic requirements. So, so when you do intermittent fasting, don't just be very, be plentiful with the amount of different variety of foods. Do high density nutrient foods. And if you're on a low calorie diet, the way that you know you're on a calorie diet is you're also going to be really hungry all the time, and you're going to also crave certain things. Okay? So the way I look at it is when you're in intermittent fasting and you feel good and you're not hungry anymore and you have energy and everything is cool, you're not losing your hair, you have enough nutrients. You're not really on a low-calorie diet. But when you're on an intermittent fasting, your body goes into ketosis. So now you're living off your fat as fuel. So part of those calories that you're running on, in addition to the 1,200 calories, is your own fat calories as your meal. So it's not all about just how many calories that you're eating. It's how much you're eating and using from your own body reserve. Low-calorie diets don't look at the insulin factor very often, and then they end up, you don't end up burning fat. You just starve your body, especially on certain diets that I won't mention any names, even though I want to. But another indication that you're doing it incorrectly because you're not having enough nutrients in the calories is that you're consuming, you're losing your hair, you're losing your teeth, you're feeling tired, you're craving sweets. That means you're not doing it right. Okay, so I hope that helped, and thanks for your question. All right, so we have a question from Wisconsin. I think it's Dia from Wisconsin.
Daya.
Daya. Okay. Hi, Daya. Southeast. What town?
Hi.
What town, Wisconsin?
Watertown.
What was that?
Watertown.
Okay. Cool. I'm originally from Kenosha, Wisconsin.
Oh, okay. Nice. Well, thank you so much for taking my call. And my main concern is my energy level.
Okay.
I appear to be very healthy, but I definitely am drained all the time, and I have little children, and I don't seem to get done the main tasks of my home. I struggle. So a naturopath recommended me to supplement with a ubiquinol, and that seems to help a lot. And recently I started doing the ketogenic diet, and that helps too. But when I ran out of the ubiquinol, then I crashed again. So I just don't understand what the relationship is. Is that an indication that something else is wrong that I should be doing? What information can you share on that enzyme?
So I have a question. Are you sleeping?
I sleep pretty well. Yes. Excuse me. Yes.
Okay.
I'm not a worrier, and I pretty much if I lay down in bed, I fall asleep.
Do you feel rested when you wake up?
Not every morning, no.
Okay.
No, and sometimes I do have achiness in my joints when I get up.
Do you feel? Do you find that you're tired after you eat lunch?
If it is a big meal, yes.
Okay.
I do feel tired.
Do you have?
And I used to feel before the ketogenic diet, I used to feel like a hypoglycemic symptoms.
How old are you?
Like if I don't eat, I'm 40. I'm just turning 40 this month.
Okay. Do you have any bloating or digestive issues?
I burp a lot.
Burp. Yeah. Okay, so based on the limited evaluation that I just did there's a couple areas I would look at to enhance your energy levels, and that would be burping is an indication of gallbladder, which also means that you could have low stomach acids. So what I would do, first thing I would do, because as you get into your 40s and 50s and 60s, your stomach acid goes down, and people a lot of times they get tired because you need that strong stomach acid to absorb B12, protein, trace minerals, and minerals. So the first thing I would do is I would acidify you by doing either apple cider vinegar or apple cider vinegar pills, and start taking more of that acid, and even kombucha tea. A lot of times your energy will go way, way higher because now you actually can start pulling in and absorbing things. The other thing is like the gallbladder, you might need some bile support. And what the distinction of that is that your thyroid works through the liver and the gallbladder. So without a good gallbladder, you might not be converting the thyroid, and right there you're going to be tired. So there's a lot of things you just told me that it could be. But of course, if I had time, I would keep asking you more and more questions to see what's the most likely cause of fatigue. But watch my videos on some of the ones on fatigue, because I have like the 12 reasons why you might be tired, and then that way you could really find the real reason. For you to have to take a certain supplement just to get your energy up tells me that it's camouflaging a hole in the bucket. Okay? So check out those things and then let us know if it helped you. Okay. So so we have someone from Des Moines, Iowa. Gisela, I think it is.
Yeah, Giselle. Hi, Dr.
Giselle.
Berg. Good
Hi.
morning.
Good morning.
I have a question. I hang out with people that have lost weight in everyday life, actually. And I myself have lost weight, but I keep yo-yo dieting. My question is, people that lose weight often have saggy skin, but they either have saggy skin or they have saggy skin with fat. What can attribute this difference in weight loss? And also, how can people avoid saggy skin with weight loss?
Good question. Okay, next question. No, I'm just kidding. Here's the problem with people that when they lose weight, a lot of times especially you ever see The Biggest Loser, or they have to get surgery because of all this skin, extra skin, or when you do gastric bypass. The real big point is that the skin is the largest organ in the body, and if you shift your goal to be healthy, the skin will come back as you lose weight. Unhealthy weight loss from using appetite suppressors, gastric bypass, because it's so radically, you're cutting out part of your stomach, you're not really getting healthy doing it. You end up with a lot of skin issues and collagen issues. What will tighten the collagen is just focusing on getting your body healthy as a primary goal, and you'll lose it. I'll give you an example. I had a gal who, she was on 19 different drugs, and she lost a little weight, but she was still like 225 pounds, and she was stuck. So, and she's tried everything, and she didn't want to do the surgery and stuff like that. So to spend an hour just convincing her, like, take the weight loss goal and just put it over here and just focus on getting your body healthy. And what happened as a result of that, she started being able to come off these medications one by one. She went from 19 drugs coming off into all the way to, she was left with one drug she was still on, but she was off like 18 different drugs. Right there, that's the therapy in itself of getting healthy, because not having to take that. Anyway, I didn't see her for a long time. 2 years later, because she did have, when she lost some weight, there was still some stretch marks and some puffiness, like some type of fat that's kind of spongy when she left, when I saw her last. And then she came back 2 years later, and she maintained that healthy lifestyle. Because a lot of times people lose weight and then they just gain it right back because their goal is not deep enough to get healthy. So I got her convinced that she needed to get healthy. Anyway, 2 years later, she comes in, walks in my office. She has her winter coat on. She takes off her coat. I was like, is that you? Oh my gosh, that was amazing. She dropped down, beautiful figure, everything was back to normal. So it just took a period of time for her body to really come together and tighten up the skin, get her figure back. So I guess my short answer to that question would be to focus on getting healthy. And I know that might be a general answer, but I have videos on the specifics. All right? Thank you for calling. All right, so we have another question from Camera from Iowa. Go ahead, you're on the air.
Hi, Dr. Berg.
Hi.
My question is, I'm pretty sure that I have insulin resistance, and I've been doing this keto diet for about a year now, and I've never been able to get into ketosis. But my question is that when I get up in the morning and I test my fasted glucose, it can be, like yesterday it was 103, and then I fast every day till about 12:30 or 1 o'clock. When I test again, my glucose can raise 10 to 20 points sometimes, and I don't understand why.
Yeah. Okay. So, question I have for you: how old are you?
48.
48. Have you been struggling with this for a while? How many years?
Well, I've only been doing this for about a year.
Okay. And what do you eat for breakfast or your meals? Like how many meals, first of all, how many meals a day do you eat?
I eat 2 meals a day. Yesterday, there are days, probably once or twice a week when I fast all day. I only eat one, and that's dinner. But it's usually just lunch and dinner.
Okay. And then tell me about what do you eat? Give me a real quick answer. Like what do you eat in that meal?
For lunch, I eat my 7 to 10 cups of salad every single day that I do eat lunch. I've got that in there. And then I'll have a little bit of protein. And then for dinner, I try to have another salad, not as big as the one for lunch, couple cups, and then some more protein. And I try to stay within the 3 to 4 ounce range there.
Okay. And do you, have you ever had your fasting insulin tested?
You know, when I watched your video on that, and when last time I went to the doctor to have all of my tests done, they said they'd never heard of that they just did the regular, they did your normal cholesterol and all that, and they did that, but they said they'd never heard of a fasting glucose.
Insulin, yeah. Yeah,
fasting, yeah.
Yeah, then you need to find another doctor to do that test because it'd be really curious to see what's going on with your insulin. It sounds like you have insulin resistance. And like, here's the thing. You may see improvement over time, and that's great. And it might take a long, long time. There's always things that I would do to enhance what's going on. Obviously, you had it a long time, so it takes a while to actually pull you out of that. But there's other things you can do to speed it up. For example, look at the other health problems you have possibly. Your sleep cycles, the quality of exercise, the level of inflammation in your body, any female hormonal issues. Like those are the areas that I would focus on. And then also additional things that you can do to add to the scene. Enhance it with the potassium, the B1, the chromium, these other things. That's what I would do. And unfortunately, like I run into this all the time when you have people, especially with liver issues. They're like, well, I did it for a period of time, but it's still not perfect. I know. I says, well, guess what? It takes a long time, especially if you have cirrhosis of the liver, scar tissue. It takes a long time, especially if you have osteoporosis. It takes a tremendous amount of time to undo that. So as long as you're improving, just ride the wave. Don't give up because the body does come back. But I think you're on the right track. I would just give it some more time and then look at the other problems that you might have that could be slowing you down. Okay? All right. So then we have a question from India on the ketogenic diet. Go ahead. You're on the air.
Hi, Dr. Berg. Can you hear me?
Yeah, I can hear you fine.
Yeah, thank you, Dr. Berg. So firstly, thanks first off for all the videos. It's been really educative, and I've tried to follow your advice to the T. Also tried to understand and then follow, so that makes me feel better. So everything is going perfectly well. I'm feeling a weight loss that's happening. That's wonderful. And the most important thing is I feel energetic and great throughout the day. I think that's the greatest benefit of following this. But my 2 questions to you is the side effect of following the keto diet perfectly. I feel that I'm not able to fall asleep. I do feel well rested and get a good night's sleep, but it takes me a lot of time to fall asleep. And the second problem is I do get a slight pain in my lower abdomen. I think place where your kidneys are sometimes.
Wait.
Not
Repeat.
always, but sometimes.
Repeat.
So I just want to know.
Repeat yourself on that last point. You have a pain?
Yeah, a light pain below near my belly, in the underbelly.
Okay.
A light pain. So.
Okay. All right. So couple questions. The question that you had is like you're doing the ketogenic diet. You're getting a lot of good things, but you're not sleeping. You feel rested, but you're still not sleeping as good as you would like. When you're on the ketose diet, there are several things that do change in your physiology. You require more nutrients and we got to deal with it. One is that your potassium levels do decrease, okay? And your calcium levels do decrease. Both minerals are needed to wind you down and also prevent kidney stones, which could be that, not saying you have one, but it could be something going on in you, especially if it's in lower abdomen area. But also the insomnia thing, I would spike more potassium and some calcium. Now, the calcium that you consume needs to be calcium citrate or calcium lactate or calcium magnesium, not calcium carbonate. And you take this right before bed and take a little potassium. Usually those electrolytes will just, boom, handle you and you're right to bed. So that would be the obvious thing that I would do. The other thing is I have a whole thing on insomnia with acupressure, which I do, which I don't think you need that because this is a recent thing. But it's like pulling the stress out. But I think your issue is going to be calcium and potassium. Go ahead and do that and just let us know if it worked, okay? Thank you so much. Okay, so we have Sharon from Georgia. Go ahead, you're on the air.
Oh, yes, sir. I'm trying to use alkaline foods to fight cancer. My husband just had bladder cancer surgery, and I'm not really understanding exactly how to use the pH numbers. One of my questions is actually about water to drink because these YouTube videos are quite confusing. And I'm wondering, do I go by the urine pH or the blood pH? He had his post-op appointment yesterday, and his urine was 7.0. Could you give me some understanding about exactly how to read these numbers and how to go about this?
Yeah. Sharon, so has someone told you that you get cancer if your pH is alkaline?
No. In fact, acidic is what we've been told.
Oh, it's acidic. Okay, so basically you'll get cancer if your pH is acidic, right? That's what they told you?
Yes, sir. And
Okay.
I was trying to work toward an alkaline goal.
And did they tell you what fluid would be acidic in a cancer state? Like what fluid they're talking about? Was it urine? Something else?
No, sir.
Saliva?
That's what my question is. What do I go by?
Okay. All right, Sharon, let's just talk about pH since you brought up a can of worms there. So basically, in your body, each part of your body is a different pH. The saliva is alkaline, the urine should be acid, the stomach should be extremely acid, small intestine should be alkaline, the bile should be alkaline. So it's very confusing. And when these people that are putting out these videos, like everyone is acid on a cancer diet, that's false data. That's false information. Okay? It's not true. Your blood should be slightly alkaline, but the urine should be slightly acid. So for you to start acidifying your body or alkalizing your body is not going to help you in the area of cancer. What you want to do is you want to bring the pHs to their normal amount. You want to keep that urine slightly acid to kill off the microbes. You want to keep your stomach really, really acid because if you actually cause an alkaline stomach, your cancer rate increases, your chance for H. pylori go up. So anyway, I think they're basing it off what the blood pH should be, which is slightly alkaline. So this is, well, everyone should be alkaline. Well, normally you should be alkaline in the blood, slightly. So here's what I would do. I would not use the pH as your indicator for health. Take that, it's because if his pH is 7, he needs to acidify his body with apple cider vinegar or with betaine hydrochloride or something because it's too high. That's what I'm going to recommend. In fact, when you're adrenal dominant and you're adrenal stressed and you have a lot of cortisol, the body naturally goes into an alkaline state that's even too alkaline. It's alkalosis. Yeah, your blood becomes excessively alkaline. So you take how many cancer cases are alkaline? I mean, are adrenal, a lot of them, and they're naturally going to be too alkaline. So if you put more alkalinity in there, you're going to create worsening of your symptoms. So here's what you need to do. Don't worry about the pH. Don't consume alkaline water that's created like other than natural spring water. If you start drinking alkaline water, I've tested people with that are drinking alkaline water, and their pH is a 9. That's off the charts. That's throwing off your chemistry into a state where it's like way, way off the charts. I know there's going to be some people disagreeing with me, but you can't deny the fact that your body operates at different pHs. And if you try to do a global alkaline diet with everyone, you're going to have a problem. Now, the healthy foods that I'm going to recommend are a lot of vegetables with some protein and some healthy fats. So of course the vegetables are alkaline, but that's not really the benefit of the vegetable. It's the benefit of the vegetables is the vitamins and the minerals and the phytonutrients, not the alkalinity. Your body's pH, it takes a lot to throw off your body's pH. And eating unhealthily will do it. But if you put your body into a healthy state, the pH will go where it needs to go. Okay? Oh, you got me started on that one. No, just kidding. Okay, good. So, Mike, you have a question, and you're from Minnesota.
Yes.
Hi, Mike.
Good morning, Dr.
Good morning.
My main question, I'll just hit it, is rosacea. I've been following you on YouTube for probably 3 years, but I've been eating right for probably 8 years because I started out with candida. So I've been drinking apple cider vinegar anywhere between 3 and 8 years every morning with lemon juice, a juice of lemon, 2 tablespoons of apple cider vinegar, 8 ounces of water. And I every other morning I do 1 tablespoon, 2 tablespoons. In other words, 2 tablespoons one morning, 1 tablespoon next. Anyway, my question is, I'm trying to eat right, but this rosacea is bugging me, and I would like to know if I'm eating right.
Okay, great, Mike. Thanks. Yeah, I was in Minnesota when I was in the military and the 2-week training up there, the land of 10,000 mosquitoes, right? A lot of mosquitoes up there. But anyway, the point is that rosacea is a microhemorrhaging of the blood vessels that happen in the face. The biggest thing to improve that would be the whole vitamin C complex. And bell peppers have massive amounts of vitamin C, whole food vitamin C, that I would recommend for sure. You don't want to do synthetic. And that will help spider veins, varicose veins, and rosacea. Now, there are other reasons why people have rosacea. One would be the adrenal stress. So that's another area that you can work on. I notice you have hepatitis. So if you have hepatitis, that's a virus. And so what you want to do is keep that virus in remission. Vitamin C will do it. And zinc, very important. But then if you want to prevent, the real damage with hepatitis is the darn scar tissue that happens after the inflammation with the cirrhosis. So there's a great enzyme, too, to look at. You can research this called serrapeptase, taken on an empty stomach. Take 200,000 IUs 3 times a day. That keeps the scar, that actually helps reverse scar tissue on your liver. So that's one thing. But I would go after the vitamin C complexes from stuff like bell peppers and eat a ton of them. I think that might actually help you, Mike. So go ahead and try that out, okay? Okay, so Irene, you're from New Jersey. Go ahead.
Yes.
You have dry eyes, right?
Blepharitis.
Mm-hmm. So do you have any bloating or digestive issues?
No, I actually do take your apple cider vinegar tablets.
Okay. Well, let me tell you the first thing that comes to mind with that, Irene. Dry eyes is usually not necessarily a dehydration problem. It's a deficiency of certain fats, essential fatty acids, specifically vitamin A. Now, by taking vitamin A, it might not work for you because you might not have the bile. So there's 2 things I look at. Bile for the gallbladder, getting that working better, even taking bile salts, and then vitamin A from the cod liver oil. That's what I would do if I were you to resolve your dry eyes. So go ahead and try that and let us know if it helps you, okay? So hey, listen guys, I really appreciate your questions. There's a lot more questions and I can't get to everything, but you guys had really good questions. So I appreciate that. Thanks for being on, and I'm going to see you guys next week on Q&A. So have a great week.